Okay, Prevena Vacs are one of my favorite adjunctive things to do to help my patients heal. Let me show you what it is and I'll explain how it works. So wound vacs have been around for a very long time in medicine, and we've used them traditionally to heal open wounds. So you're in a car accident, a big chunk of tissue is missing from your thigh, we can put a sponge in it, plastic wrap over it, attach it to a machine that gently suctions, and that will help the wound heal faster. Now, we couldn't use these older vacs over normal skin because it would actually break down and harm the skin. Prevena Vac is a solution to that problem. So we get the benefits of the vac, that negative pressure, but it's safe to use on intact skin. So this is what we do. So after you have surgery, all of your incisions are closed. Instead of putting a traditional dressing on, we put a vac. And this is what the sponge looks like. This is a customizable sponge. So we can cut this to any size, shape that we want it to be. And then we cover it with some of this plastic wrap. It's the same stuff we use for a wound vac in the hospital. And then there's a little plastic lily pad with a tube, and it's hooked up to one of these little pumps. This is a single-use pump. It's not cleaned and reused on patients like the ones in the hospital are. Single use. And this device stays on for 7 to 9 days after surgery. So during that week that the wound vac is on, that gentle negative pressure is going to dilate or enlarge blood vessels under the skin. The first thing those dilated blood vessels can do is bring extra blood flow to the area, so it's going to heal better. The next thing that it's going to do is allow those blood vessels to absorb fluid from the tissue and get rid of swelling faster. So not every single patient needs to have a Prevena wound vac for every type of surgery. We usually reserve these for patients that are having a procedure that's associated with more wound healing complications, or people that have medical problems that can lead to worse wound healing complications. So in my practice, I use the Prevena in breast lifts, breast reductions, breast reconstructions, and tummy tucks. These are procedures that traditionally have an elevated risk of wound healing problems, and I find my patient's risk is very low, and I think the Prevena Vac is a big part of it. The other population of patients that do great with Prevena Vacs are patients that have medical problems that can lead to poor healing. That's going to be diabetes, hypertension, immunosuppressed patients, if you're a transplant patient or you have an autoimmune disease, patients with prior radiation. All of those things can give poor healing, even in a surgery that doesn't traditionally have poor healing. So Prevena Vac is a great option for those patients as well. And you certainly can have one just because you want one, because it does, of course, help healing. It also seems to make scars look better, so it's also used in treatment of keloid scars. So when I'm revising patients that have keloids or terrible hypertrophic scars, I often use a Prevena Vac. So how do you get it? First thing is just discuss with your doctor and they'll let you know. Sometimes the hospital, if you're having an insurance covered surgery, the hospital you're having surgery at will carry the Prevena wound vac. Both the hospital I work at, Cedars-Sinai, as well as my Quad A Surgery Center have Prevena Vacs that are there for me to use. Now, if your hospital or your surgery center doesn't have the Prevena Vac, you can purchase this yourself, or your surgeon can, and you can often bring it in for use. Since it's not used during surgery, it's just a dressing, most hospitals will allow you to fill out paperwork to use it. Now, the question most people want to know is, do I have to pay for this? And the answer is maybe. So if I'm doing insurance-covered procedures and it's carried by the operating room or surgery center I'm working at, they bill it to insurance and my patient doesn't have to pay out of pocket. But if it's a cosmetic procedure or it's not carried at that hospital, you may have to pay out of pocket. The cost of the vac is going to vary depending on which vac you use. There's different sizes and different models. It can be anywhere from, I think, $750 for the cheapest one, all the way up to close to $2,000 for the biggest one. So that's kind of the skinny on Prevena Vacs. I love them. I've been using them for about 8 years in my practice, and I think they are amazing.